Artificial Intelligence Dr. www.abcpharma.net/English. User question: what is the prognosis after single-chamber Aveir VR pacemaker implantation, especially with the lack of atrioventricular AV synchrony? Cohere AI answer: the prognosis after single-chamber Aveir VR leadless pacemaker implantation is generally positive, but it is important to consider the implications of the lack of atrioventricular AV synchrony. Improved symptom management. The primary goal of single-chamber ventricular pacing is to address symptoms related to bradycardia, such as fatigue, dizziness, and syncope. With proper pacing, individuals can expect an improvement in these symptoms, leading to a better quality of life. Most patients adapt well to ventricular pacing, and the device effectively meets their needs for rate support. Limitations of single-chamber pacing. The absence of AV synchrony in single-chamber pacing means that the atria and ventricles are not contracting in a coordinated manner. This can result in reduced cardiac output and less efficient blood pumping when compared to dual-chamber pacing. However, the impact of this loss of synchrony is often minimal in individuals who do not have significant underlying heart disease or severely impaired cardiac function. Long-term prognosis. The lack of AV synchrony typically does not affect the long-term prognosis for individuals who do not have advanced heart failure or severe cardiac dysfunction. Single-chamber ventricular pacing can effectively provide rate support and symptom relief for many years. The device's longevity is typically around 10–12 years, after which a replacement procedure may be necessary. Impact on heart function. Over time, the lack of AV synchrony may lead to some degree of cardiac remodeling, with potential changes in heart structure and function. This remodeling can include atrial and ventricular dilatation and, in some cases, the development of heart failure symptoms. However, these changes often occur gradually, and regular medical monitoring can help detect and manage these complications effectively. Advantages of leadless technology. The Aveir VR pacemaker, as a leadless device, offers several advantages. These include a reduced risk of device-related infections, fewer complications due to the absence of leads and pockets, and improved patient comfort and cosmesis. These benefits contribute positively to the overall prognosis. Patient selection. The selection of an appropriate candidate for single-chamber pacing is crucial. Individuals with intact or well-preserved AV conduction and no severe cardiac dysfunction are typically good candidates for this type of pacing. Those with more advanced heart disease or significant AV block may require dual-chamber pacing for optimal outcomes. In summary, the prognosis after single-chamber Aveir VR pacemaker implantation is generally favorable, especially for individuals with intact AV conduction and no severe cardiac dysfunction. While the lack of AV synchrony may have some impact on cardiac function over time, regular medical follow-up and device monitoring can help manage these potential complications effectively. Claude AI answer: the prognosis after single-chamber Aveir VR pacemaker implantation, particularly with the lack of atrioventricular AV synchrony, can vary depending on individual patient factors and the long-term management of their condition. Let's discuss the potential outcomes and considerations. 1. Pacing effectiveness and symptom relief. In most cases, the Aveir VR pacemaker effectively treats bradycardia and provides symptomatic relief for patients with a primary indication for single-chamber ventricular pacing. However, the lack of AV synchrony may lead to suboptimal cardiac function and hemodynamics, particularly in patients with intact AV conduction or a high percentage of ventricular pacing. 2. Pacemaker syndrome. Some patients may develop pacemaker syndrome due to the lack of AV synchrony, experiencing symptoms such as fatigue, dyspnea, chest discomfort, or palpitations. The incidence of pacemaker syndrome in patients with single-chamber ventricular pacing has been reported to range from 7% to 26% in various studies. Patients who develop pacemaker syndrome may require pacemaker reprogramming or upgrading to a dual-chamber pacing system to restore AV synchrony and improve symptoms. 3. Long-term cardiac function and remodeling. Chronic single-chamber ventricular pacing without AV synchrony can lead to adverse cardiac remodeling, including left ventricular dysynchrony, hypertrophy, and dilation. Over time, this remodeling may progress to pacing-induced cardiomyopathy, characterized by left ventricular systolic dysfunction and heart failure symptoms. The risk of pacing-induced cardiomyopathy is higher in patients with a high percentage of ventricular pacing and those with pre-existing structural heart disease. 4. Atrial fibrillation and thromboembolism. The lack of AV synchrony and atrial pacing in single-chamber ventricular pacing may increase the risk of developing atrial fibrillation over time. Atrial fibrillation is associated with an increased risk of thromboembolism, stroke, and heart failure, which can impact the patient's long-term prognosis and quality of life. Patients may require anticoagulation therapy and additional management strategies to reduce the risk of complications associated with atrial fibrillation. 5. Quality of life and functional capacity. The long-term impact on quality of life and functional capacity can vary among patients with single-chamber Aveir VR pacemakers. Some patients may experience significant improvements in symptoms and daily activities, while others may have persistent limitations due to the lack of AV synchrony or the development of pacing-induced cardiomyopathy. Regular follow-up and assessment of patient-reported outcomes are essential to monitor the impact of pacing on the patient's overall well-being and guide management decisions. 6. Device longevity and future interventions. The Aveir VR pacemaker has an estimated battery life of 7–12 years, depending on pacing requirements and device settings. Patients will require periodic pacemaker interrogations and eventual device replacement when the battery is depleted. In some cases, patients may benefit from upgrading to a dual-chamber pacing system or other advanced pacing therapies, such as his bundle pacing or cardiac resynchronization therapy, to optimize cardiac function and long-term outcomes. The prognosis after single-chamber Aveir VR pacemaker implantation should be individualized based on the patient's specific characteristics, comorbidities, and response to pacing therapy. Regular follow-up with a cardiologist or electrophysiologist is crucial to monitor device function, assess clinical response, and make appropriate management decisions to optimize patient outcomes and quality of life. Patients should be educated about the potential long-term implications of single-chamber ventricular pacing and the importance of reporting any new or worsening symptoms to their healthcare provider.